Hi, I'm Dr. Bhalja with Downtown Podiatry Physicians here at 80 Maiden Lane. And today we're going to talk a little bit about bunions. So what exactly is a bunion? I'm going to show you on this foot model that I have here, but it's also known as hallux abductovalgus. And the reason it's called that is because this big toe right here is called the hallux. We're talking about the long bone in the first long bone, which is called the metatarsal. And in this deformity, you'll actually see a bump on the medial side or the inner side of your foot. Now this can actually be caused by a variety of reasons. So there's a lot of contributing factors, which include external factors like shoe gear, type of activity or length of activity, as well as injuries that can occur and aggravate this deformity. There's also hereditary factors which play a part in the structural abnormality of the foot bones themselves. And there's also biomechanical reasons for why this can be occurring. I'm going to go into a little bit of a detail about the biomechanical factors because those are really the most important for walking active individuals. What I want to talk to you about today is what happens when you develop a hallux abductovalgus or bunion deformity. So it actually starts with the rear foot, and when the rear foot, which is the back of the foot here, and the subtalar joint, which is right here where I'm pointing, that actually becomes unstable and it goes inward like this. So you're starting to sort of walk on the medial aspect of your foot. This actually creates a very unstable midfoot or mid-tarsal joint, as we like to call it. When this happens during ambulation or when you're walking, it actually creates a lot of instability in that first ray, when I was talking about with the long bone and the great toe there. It creates a lot of instability where you want it to be rigid when you're walking. And so when that happens, you actually get a lot of muscular imbalance and structural abnormalities with the ligaments and tendons in that area. And they start pulling on the bone in all sorts of ways where you don't want it to. You get some muscular adaptation, which occurs over time, and it actually causes uneven wear of the joints in that area, abnormal pull, and this causes that great toe to actually move towards the lesser toes away from that first metatarsal. And the first metatarsal actually rotates out of position as well. So you start getting that bump on the medial side and starts to bother you. So essentially, when this happens, you actually form a lot of joint adaptation as well. So over time, it'll get worse and worse and worse until that great toe joint can end up underneath the second toe. At that point, we'd call it a severe deformity. But in the meantime, there are things we can do to prevent the deformity from getting worse and to treat what's already there. What you really want to do is come in for a clinical examination and a radiographic examination so we can develop a treatment plan that's based for you and that will work to treat any symptoms of swelling, pain, redness, or difficulty wearing shoe gear that you might have. So what I want you to do is visit downtownpodiatryphysicians.com and make an appointment today.